All right, welcome to another episode of the My Favorite Girl Caregivers Corner podcast. Today I have Sonnie Mayewski. I want to make sure I pronounce that correct.
Mayewski, but I'll answer to most things.
All right, I apologize for that, but do want to bring Sonnie in as a conversationalist in regards to brain health. Sonnie is the Tallahassee Memorial Healthcare Disorder Clinic Coordinator, and so she has a lot of information and background in regards to brain health. And our conversation today is going to be the importance of brain health, why it's important that we have a healthy brain. We want to talk about what is a healthy brain and get into some other conversation as it relates to brain health, and then touch a little bit on Alzheimer's. So, Sonnie, before I move forward with the conversation, if you would just take a moment and introduce yourself to our listeners.
Thank you so much for having me. So I'm Sonnie Mayewski. I'm a licensed clinical social worker and the Memory Disorder Clinic Coordinator at Tallahassee Memorial Healthcare. I've worked with the aging population for a little over 5 years, and it's been such a great experience to be able to share knowledge and also learn from others in the community.
Awesome. And I saw where, you got some training up under Vicky Rose, and I know Vicky is amazing at what she does. So kudos
She's
to Vicky.
full of information.
Yes, she is. And hopefully we'll be able to get her on at some point as well. But I know that what you're doing, you're very well versed in your field. And so that's one of the reasons why I wanted to bring you on here this month and throughout the next couple episodes. Part of what we do with this podcast, the whole goal of it is to be able to bring inspiration, education, resources, hope, strength, all of that to those who are caring for their loved ones. And so these next couple episodes, I want to be able to provide some resources to those that are in our community. I have various ones that contact me all the time and ask for different resources and what have you. So I made the choice to be able to provide some of that information through this podcast. And so thank you again for joining me. And just as it relates to Alzheimer's, just a couple things before we go forward. When I was looking at this, and just for those who don't know what Alzheimer's is, it is a progressive neurodegenerative brain disorder that leads to progressive mental and physical impairment. And those that know me know that I care for my mom, who is 79. I keep saying 78. She just turned 79 in May. So I've been her caregiver for the past 5 years. And then my grandmother, who is 97, I've been her caregiver for the past 4 years. So I have both of them here with me, and they both have dementia. They both have, my mom is more progressive with hers. Hers is very much more progressive. And so even in looking at that, when I was reading this, it said that there are over 6 million people that are living with Alzheimer's, not to count the over 580,000 that are right here in Florida where we are. And so when I think about that, when I look at those numbers, I consider the fact that it's very close at home for me. Both of my maternal grandparents, both of them had Alzheimer's. Then my mom currently, as well as two of her brothers, one of her sisters, and then I just recently had an aunt that passed away who had been suffering with it or living with it rather, for the past 15 years. So that's real close to home for me. And as I often share with people, I really didn't even get into the research and all of that until it came face to face with me. Till I came face to face with it, then I realized, okay, I have to educate myself so that I can learn more about it, look at the preventive measures that can be taken, because I have children of my own. And, we've also had other family members that are outside the immediate brothers and sisters, other close first cousins, second cousins, uncles and aunts of my mom's who also had it. So, given all of that, it looks like there's some type of a genetic combination there. And so I'm trying to learn as much as I can. I don't know it all. I just know what I know. And so what I know and what I learn, I also try to share that information with others so that they too can be educated about it. And so, getting into that and just delving into this conversation, let's talk about the brain health part of it. Why, or first of all, what is a healthy brain?
Sure. So, a lot of the times, we just kind of go about our daily lives and our brain does all of this work for us. And we don't really put too much thought into it because it's how it's always been. But taking good care of our body often in turn takes good care of our brain. So, doing things like making sure you get physical activity, a balanced diet, good sleep, good stress management, all of those things can lead to good brain health. One of the big components of brain health is blood flow. So, making sure that you have your blood flow to the brain is not affected by any kind of disease or injuries or anything that might impede that good blood flow to the brain.
Okay, so my drinking 2 or 3 sodas a day and snacking, that may not be so good for my brain health, in other words.
Right, over long term. And we often talk about what we call modifiable risk factors. So there are some things you mentioned. There is a genetic component to some extent with some types of Alzheimer's and dementia. So that's often out of our control. But some of the things that we can change about our lifestyle, we talk about those as being modifiable risk factors. So kind of adjusting your diet and physical activity, things like that, that
Yeah.
we can have control over.
And to be honest, I did stop. I used to drink 2 or 3 sodas a day. And on top of just the added weight and realizing that the eating habits also had to change. So I've actually recently just started back my walking at least 30 minutes a day. I'm trying to do at least 30. Sometimes I don't get to do it depending on what's going on in my house. But, just from the little research I did do, that exercise is very important. I'm doing more myself to try and actually get more sleep because, I'm used to burning both ends of the candle, and that 3, 4 hours of sleep, that's not good either. So, when you consider all of this and you're looking at what you can do, for me, I know those are some things that I've tried to change. Now, I haven't gotten all into the complete diet change, but I'm working my way there.
It's hard. It's having to give up things you enjoy, especially if you have, stress going on in life. Some of us will turn to snacks or turn to, sitting down and watching a TV show instead of going for a walk. So it's hard to make those changes, but it sounds like you really have the long term in mind, which is what we really think about is, making small changes now can affect how we live our lives as we enter those senior years.
Right. So, just since you said that, just another question that just came to mind. So, I'm in my late 40s, middle 40s, rather, not late, middle 40s. And so, when it comes down to those things, because from my understanding, even with the formation of the plaques on your brain and what have you that come along with Alzheimer's, some of that starts, from what I understand, up to 20 years prior to it even manifesting. And so, starting at this point, say in my middle 40s, when it comes down to the brain health, how much of a difference will it make with me starting at this point rather than in my 20s?
So I don't know the exact percentages on how much of a difference it makes, but I always tell people you're never too young or too old to start thinking about your brain health and your health overall. Even people who are in their 90s, these are things that are important to pay attention to. So it may not necessarily reverse anything because our brains just aren't very good at healing from damage, whether it's due to an injury or a stroke or a neurodegenerative disease. But the progression can certainly be slowed. So even for someone who might be already experiencing those symptoms, I know you mentioned that you're not, but if someone is already experiencing those symptoms, it's a good idea to take those measures to potentially slow the progression and have the highest, most optimal functioning of their brain and body.
Okay. So taking those precautions could or potentially does maybe slow it down a little bit.
Right.
Okay. So when we look at Alzheimer's, which there is no cure for it, there's no cure for Alzheimer's. And I must put in there my disclaimer all the time. It has to be one of the most rudest and disrespectful diseases I've ever encountered ever. um, just living in a home and seeing it every day. It is something. That's pretty much the word that I can use for it. It is definitely something. But with that, with there being no cure for it, the preventative measures that can be taken outside of the exercise and the sleep and the things that you've mentioned, is there anything else that can be done that you're aware of that would slow down or prevent Alzheimer's altogether?
Yeah, absolutely. So things that, there is evidence that about 40% of dementia cases overall, so, as you know, dementia is an umbrella term under which Alzheimer's falls. About 40% of cases can be prevented by managing our overall health over the course of our entire lives. So, managing those chronic health conditions, if you have diabetes or high blood pressure, high cholesterol, make sure you're seeing your doctor for that, make sure you're being tested for those things. And if they do come up, taking those steps to manage them. So, you can't necessarily change your genetics, and then age is the highest, largest risk factor for Alzheimer's is age, is being 65 or older. So we can't change that, but we can take those steps like exercise, staying socially and cognitively active, and managing things like our cholesterol, our blood pressure, and our diet. And not smoking is another big one that can cause those vascular changes that in turn
Mhm.
affect the brain.
Okay. All right. So, in your opinion, I don't know how often you've seen this. I know, and we'll talk about the memory disorder clinic in just a moment, but in your profession, when it comes, I say, for instance, people like myself who have seen this in and out of family, you're closely connected to it. Um, is there a fear, or have you seen a fear of people who may be experiencing some of the symptoms, but they're fearful of coming in to see you or to see one of the neurologists to be tested because what if it is this? Do you see that often in your profession where they just would rather not come in?
Yes, I see that a lot. And oftentimes I'll hear from it, most often it's the wife, I'll say spouse, but it's often the wife will call and say, I've noticed some changes in my husband, but he is either in denial or he doesn't know he's had these changes or he's scared. What can I do to get him to come into the clinic? So it is pretty common. Ignorance is bliss, but it is so important if you're noticing those changes in yourself or in a loved one to take that next step so that you can be empowered and use whatever information you gain, whether it's a diagnosis or something else, to inform your next steps.
Because you definitely can still have a good quality of life, even if you're diagnosed with Alzheimer's or one of the other dementias. You can still have a good quality of life, but the longer you take to go be diagnosed, get the other help you need, that kind of makes it worse, right?
Right, absolutely. If you come in and you do receive a diagnosis of Alzheimer's or another type of dementia and it's early on, you can, start planning for your future and make sure that, whatever decisions, whatever choices you want made for your future, that your family is aware of that. You can start a plan of care, so you can continue to live the rest of your life in the way that you would have wanted.
Yeah. And I think that's been a big thing. I know for me, I actually considered, I'd gotten the information, I think from Marissa. She sent me the information. And I remember when my mom was first diagnosed and the doctor that she had at the time, I actually asked him, like, is there any type of testing that can be done so that, we know, because I have siblings and, it's, again, because it's right here, it's so close, kind of want to know. And I remember asking him about the testing, and he said, well, yeah, there is testing that we can do. However, I won't do it because he's like, what benefit would it be to you if I tested you at this point and you find out that, yeah, you may have some signs of it? He's like, what would that do for you, other than scare you? And so the more I thought about it, I'm like, I don't know. And to be honest, being here with my mom day in, day out, seeing the different behaviors, what have you, even though I got the information, I just sit back and say, well, do I really want to know? As someone who, you know, having to deal with it, do I want to know? But I'm realizing more and more that it's important because you want that information. So, like you said, you can prepare yourself, you can prepare your family in, just in case. God forbid, but I'm thinking about it. I'll say that I am thinking about actually becoming a part of one of the trials, because I think that's important too, especially for African Americans. And I'll just throw that out there because we are at a 2 times greater rate of being diagnosed. And so, it's important as well to become a part of the trial so that, the research and what have you can be done. So I was just curious, with what you do, whether or not you see those who are like, yeah, no, I'm never doing that.
Absolutely. And we often, we'll have people come in, and this isn't always the case, but there are a lot of other things that can mimic the symptoms of dementia. So whether it's a vitamin deficiency, a problem with the thyroid, high stress levels, or mental illness like depression or anxiety, there's a lot of different things that can be reversed that will cause those symptoms of poor concentration, poor memory, poor executive function, which is things like planning and sticking to a plan. So, if you see a doctor and tell them I'm having these problems, they'll probably order a few tests, and they may be able to rule out other things that are causing those symptoms that can be changed.
Oh, that sounds good. I never really thought about that because, could be something else. So definitely. So if you're out there and you're having the symptoms, in other words, take a moment to talk with your doctor. Don't be afraid to share with them what's going on with you. Memory loss, I know. And it's funny because sometimes I can actually walk in my room, and we all do it. You can walk in your room to get something and you forget what it was you went in there to get. Now that's not abnormal at all.
Right.
But when you're caring for someone with dementia and that happens, the first thought that comes to your mind is, oh my gosh, I don't know how many other caregivers actually deal with that, but stuff like that. And so, I mean, to rule it out is very important as well. So from this point, let's talk about the memory disorder clinic. I know that TMH has the only one in this region. Am I correct? Okay.
Yes.
So
You serve. Sorry, go ahead.
I was about to say, so tell us about the memory disorder clinic, what you all do, how
Sure.
you
So
serve
we
our
are one
community.
17 memory disorder clinics in the state of Florida, and we're funded by the Department of Elder Affairs. So the Tallahassee Memory Disorder Clinic serves Leon and the 9 surrounding counties. And we are a team of neurologists, neuropsychologists, and social workers. So the doctors provide the diagnosis and evaluation side of things, and the social work team provides education, support, and referral to research and resources for patients, for caregivers, for family members, and then also for community members in general. So even if someone is not a patient of one of our doctors at the clinic, they can give me a call, and I'm happy to connect them with resources, with research projects, just offer general education and advice and support to anyone who might be caring for someone with dementia or experiencing it themselves. Then we also do a good bit of community outreach. So if there's any groups out there, any organizations that would like to know more or are interested in a presentation, we are able to do that as well.
Okay. So if anybody just make an appointment with you? Is there a particular insurance that's taken? Or if I don't have insurance, but I have this concern, can anyone come to your clinic and be seen?
Yes, so we can either take referrals from other providers or someone can self-refer. They can get in contact with me to go through that self-referral process. We take, any kind of insurance, and people without insurance would be able to come in, would pay out of pocket. And that's for the doctor's visit. Now, a visit with the social work team, there's no copay for that. There's no charge. We're happy to sit down and chat. We're able to offer brief memory screenings that isn't necessarily a diagnostic tool, but will kind of inform where the person is at on that day and kind of note if there is a reason to be concerned. So everything the social work team does, there's no charge for it, no copay. And then if they were to see one of the doctors, that's when there would be a copay, and we can facilitate getting an appointment with one of them if someone is interested.
Okay. And so you all serve our region, but there are memory clinics throughout the state of Florida. So if there's someone else that is listening outside of, which I know there will be, but those that are listening outside of our area, where would they find the information for the other memory disorder clinics throughout our state here in Florida?
So that would be on the Department of Elder Affairs website. So if you search Department of Elder Affairs on Google and go to their website, I believe it's elderaffairs.org is their website, but you can also find it just by searching Florida Department of Elder Affairs, and then search memory disorder clinics. It will pull up a map of all of the clinics. There is one for every county in the state.
Okay. Awesome. So please take advantage of this. I think what you all are doing there at the clinic is great, especially for those who are dealing with this. There's some people who, they have no idea what it is when they start. They don't have a clue. I know for my mom, it started because I was familiar with some of it. But it started with the losing of the keys. It started with, the things that we consider to be small, and then progressed. But even with that, we still didn't, at least I didn't, we didn't think to say, maybe we need to get this tested, get you tested with the right. It wasn't until a lot later that we realized something else is going on. And then I made mention of it to her doctor, who then sent us to the neurologist to do some testing. But by that time, it was, I'm not going to say too far gone, but it was at more of an advanced stage. And so some of the things that we may have been able to do, at that point, it was just managing the diagnosis from there. And so my advice really to everybody that's listening, if that is a concern of yours, please reach out. We have Sonnie's information. And for those, she is at the TMH Disorder Clinic. You can give her a call at 850-431-5002. Give her a call there, or you can send her an email as well. And her email is SONNIEWSKI@tmh.org. So reach out to Sonnie. She and her team will be more than happy to assist you. Now, you all also provide resources. You talked about some of those resources. Are you connecting them with other support groups? I know saw that on the website. So you have support groups, you have information out there for caregivers. Are there any pamphlets or any materials that you can mail out or email to those who may be interested if they just want to see what are some of the signs, what are some of the symptoms that are associated with, Alzheimer's or any other brain related disease.
Yes, absolutely. We have a whole resource closet that is filled with educational materials, things about planning for the future, things about making sure that the home is safe for someone with dementia, um, support groups, information on responding to some of the behaviors that may come with dementia, all kinds of things. And normally, if we don't have it in clinic here, we know where we can get it from. So if there's ever any questions about anything specific or general about living with dementia or caring for someone with dementia, we can normally get our hands on it and get it sent out to someone.
Okay. And do you all do anything? Because I know this is another big thing when it comes down to the being able to put in place a power of attorney, those things that we don't really think about in the beginning stages of this, when you realize that someone who has this diagnosis may eventually be without their complete memory. And so setting things in place like a power of attorney and making out your living will or things of that nature, is that something as well that you all provide or you refer out so that, because this is important, we don't really think about it until we're in that situation. And if they don't have power of attorney or they don't have a living will or the other documentation that's necessary, they may be, I'm not going to say denied care, but you won't be able to make decisions for them if they're in a situation where a decision has to be made, guardianship, that type of things. And I'm going to have another episode on to deal with that because people don't really think about those things that need to be in place. So is that something that you all provide there at the clinic as well?
Yes, absolutely. So every patient that comes in gets, as a part of our resource book that we give out, there's a checklist on Family Matters. So it includes all the things you mentioned and even some other things that people might not think about. So things like making sure you're on the person's financial accounts, making sure you know where they're keeping their important papers, alarm codes to houses, making sure you have all of that information. And then we also are able to connect people with elder law attorneys here in town. So that's the best place to go if you're kind of doing those future planning documents, is to go through an elder attorney. They're very well versed in these special topics that pertain to people with dementia and older adults. And then we also maintain copies of 5 wishes here in office, which is an advanced directive form that people can fill out to make sure that their wishes are met if they're ever in the hospital, if they ever reach a point where they can't communicate their own wishes.
Okay. Yeah, I had to fill out one of those for my grandmother. So I do have that on file for her. I know we went through it. It can seem a little morbid when you're going over it because no one really wants to think about dying, but you realize that those things are important. So I had her to give me all the information that she would like in the event that she passes away. So that's always a good thing to have. And I keep it on my file. So whenever we go to the doctor's office, if they ask, yes, I have a copy of it. And so all of these things are extremely important. So reach out. I cannot emphasize that enough. Reach out to Sonnie, reach out to their team. Go ahead, get the testing, get it done because this is very important. At the rate that Alzheimer's, and I'm just going to give you some facts, and we're going to get into because Sonnie and I connected through another means as well, another avenue, and that is the Tallahassee Walk to End Alzheimer's. I have been a part of that for the past 3 going on 4 years, and it has been very beneficial to my life, beneficial to just the support that is there as well. The team that I work with, the committee, all of you all are phenomenal. The support that's there. I've been able to meet some dynamic people, build some great friendships through the Tallahassee Walk to End Alzheimer's. And this year, Sonnie is actually the co-chair for the Tallahassee Walk to End Alzheimer's. And so we're connected there, and I'm looking forward to working with her even further, even beyond the walk. But we're going to talk about the walk a little bit now, and I just want to give some facts in regards to Alzheimer's. And so, again, we mentioned earlier that there are over 6 million Americans that are living with Alzheimer's. That's a lot of people. And when you look at the statistics, it is predicted to grow even more, almost triple what that is over the next, 5 years. And that is alarming, very much alarming. And right here in Florida, over 580,000 people that are living with Alzheimer's. It is also there's between 2000 and 2019, deaths from Alzheimer's increased by 145%. And as I mentioned earlier, 2/3 of Americans with Alzheimer's are women. And so we really have to jump on whatever it is we need to do to try and get these numbers down. That's a lot of women. 1 in 3 seniors die with Alzheimer's or another form of dementia. Alzheimer's is the 6th leading cause of death in the United States. Okay. That's more than breast cancer and prostate cancer combined. That's a whole lot. And then when you look at caregivers, such as myself, you have 11 million Americans that provide unpaid care for people with Alzheimer's and other dementia. And that doesn't take away from, you having to miss work. I remember those days, having to miss work. And when you miss work, you're missing income and you're not being paid to care for your loved ones, which, most of us, it's not about the pay. But when you look at it, you're losing finances when you have to take off. I know my mom went through a stage of wondering, and I encourage anyone who is working, get FMLA because it does work for even dementia, Alzheimer's, if you have a loved one that you're caring for. If you have the ability to, when you're working, fill out the forms for FMLA because you may very well need it. I had it in place. And so there were times when, I would be ready to walk out to go to work. And then my mom would get up and I'm having to see, because initially she was able to stay home by herself. But there were some things that she may do in the process, especially getting up, that I would have to end up being late to work for because I had to take care of that before I left to go to work. And unfortunately, I think they're coming around a lot more now, but unfortunately, a lot of employers are not sympathetic to the fact that you're caring for someone with Alzheimer's and honestly with a lot of these different issues that caregivers are caring for their loved ones for. And so FMLA is a great way to still be able to care and secure your job. But if you're having these type issues, please, talk to your employer, let them know what's going on. But that's just a plug that I threw in there. But basically, Alzheimer's it's affecting us at a large rate. And reality, and I say this a lot as well, it's touching everybody everywhere because you either know someone who has it, someone who cares for someone who has it, or you yourself may have it. Tell us a little bit about your role and how other people can get involved with the Alzheimer's, Tallahassee Walk and Alzheimer's.
So I'm the co-chair for this year's walk. So I work closely with our chair, Yolanda, and then our staff partner at the Alzheimer's Association. And, working at the memory disorder clinic, I've really seen what a difference the programs, the research, everything the Alzheimer's Association does really has an impact on both the larger scale as well as on individuals and families and caregivers. They do a ton of research. They're very heavily involved in advocacy. So we just had legislative session. They have a rally and tally in which we set meetings and advocate for legislation that really impacts the lives of people living with dementia and their caregivers. They do a lot of awareness campaigns so that people know what to look for, people know how to interact with someone living with dementia, caregivers know where to go for help. They do a lot of educational presentations and meetings, and then also things like support groups and programs that really support people either with early stage dementia or caregivers. And so the Walk to End Alzheimer's is really an opportunity to raise funds that go towards all those wonderful programs they do. And 78% of the funds that are raised go towards things like care, support, research, awareness, and advocacy for people living with dementia and their caregivers. And just the walk in and of itself does a lot to increase overall awareness of Alzheimer's and what the caregivers experience. It allows people a chance to share their story and their experience and really get the information out there. We would love to have anyone create a team. If you have a family that you would be interested in creating a team with, if your workplace, if you're part of any community groups, you can visit the alz.org website and create a team from there. You can raise funds. There's a lot of different opportunities to ask for funds. You can create a Facebook post, a Facebook fundraiser, to raise funds that all go towards all those wonderful things that the association does.
I invite everybody to sign up for my team, but I think what is even greater is when you can form your own team. When you can, through your employer, through your organization, I know quite a few people who are in fraternities and sororities, churches, your group, wherever it is, form a team of your own. That is the greatest way to be able to participate with this. Of course, again, you know, we'd love to have you on my team. Other people that have teams would love for you to be on their team. But ultimately, the whole goal is to be able to bring in funds to help with the research, the caregivers, all the things that the Alzheimer's Association offers. And this is the largest fundraiser for the Alzheimer's Association. And so that's why we make it as big as we have tried to make it. Unfortunately, last year we weren't able to come together as we were, but it still went off perfectly online. It was absolutely amazing to be able to go in, all the interaction. I was wondering how in the world they're going to pull this off, but it was awesome to watch the ceremony online. And we were in every neighborhood last year, and we were able to do that because everybody, or quite a few people, walked with their group, or those on their group walked in their own neighborhoods, or they're on their own trails or tracks, wherever they were. They all walked, and it still served the purpose for which it was, you know, put together. And so this year we are looking to be back together. So everybody will be able to come together, walk together, of course, safely. We are still taking those measures due to COVID, but it's going to be such a great joy to be able to connect and be out there where you have hundreds of other people who have connected as well because of this cause. There's nothing like being in it because you're caring for someone, but when you get other people to connect with you, your friends, your coworkers, all of them who may know your story because you've shared it. Like, I have a lot of people that know my story because I made the choice to be able to share it because I want other people to know what this is like. And so I've connected with quite a few people through that way, but it gives people the opportunity as well to see others who are on the same journey, who are in the same fight, because as the theme for Alzheimer's is we are doing this because we are looking forward to a world without Alzheimer's. So that's what the walk is all about. We've done the white flower, we've done the blue flower. I will always stand with that white flower because I'm looking forward to the day when we can say that there's a cure for this and it's not affecting people anymore. And so that's what this walk is all about. Sonnie's doing an amazing job. Her and Yolanda, they're spearheading it. They're making it happen. I'm on the committee. I'm doing as much as I can and probably need to do a lot more. I'm working to do a lot more. But
you're doing awesome. We're so glad to have you.
They are simply amazing. We did the bingo night, and that was fun. I almost thought I was gonna win, and yeah, it didn't come through. But it was absolutely fun being able to play the Alzheimer's bingo. So we have some other things that are coming up as well. So partner, join our team, join the cause, bring in some teams, and if you can't join, you don't have time to join, you don't want to walk, become a sponsor.
Absolutely.
We still need more sponsors, right?
We will always take more sponsors. Yes, absolutely. Please feel free to contact me if your organization or if you're interested in becoming a sponsor or even be an individual donor. So visit that website that's scrolling at the bottom for the walk and, pick a team, pick a walker and put in an individual donation.
Yep. And we'll take it. We're going to take all donations. We do have a financial goal and we want to surpass that goal this year. We want to be able to knock that goal out the park. And then not only do I have a team, but Kaylin, my daughter, also has a team. She is actually an advocate as well. And, she started the youth caregiver movement here. So that is going. And so she's actually formed her own team, and that is Team Youth Care too. So she's looking to have as many youth as she can get on her team as well, because they want everybody to know that it's not, but youth also care too. And so they're going to rally behind, be out there walking. They're going to have their little shirts made, youth care too. And they're looking forward to also connecting and doing some great things for the Alzheimer's Association. So this has been absolutely amazing, Sonnie. Thank you so very much. And for those of you that are listening in, give her a call, contact her. Let's not just learn about brain health, but let's do everything that we can to make sure that our brains are healthy, that we're spreading the word out there to others to help them also keep their brains healthy, and then take advantage of the resources that are out there for us to be able to, even if there's a diagnosis, to be able to live your best life with the diagnosis that you may have. So Sonnie and her team of social workers, the neurologists, all of them are available out there as well. I didn't get to talk about it, but just a little bit. I saw the Dementia Care and Cure Initiative of the Big Bend. What is that all about?
Yes, absolutely. So DCCI, it started in Tallahassee in 2016. Tallahassee was named the first dementia-friendly community in Florida. Since then, it's expanded to cover the whole Big Bend, and then there's also 14 other Dementia Care and Cure Initiative cities that are task forces that have started. And what it's all about, it's about raising advocacy, awareness, and access about dementia, for caregivers. And I'm the co-chair for the overall task force, and then also the chair for the education subcommittee. So what that means is I reach out to different organizations, different businesses, different agencies, and offer trainings on dementia sensitivity, specifically tailored towards whatever kind of work they do. So we've done them for restaurants, so we'll specifically educate waiters and waitresses on things they might encounter if they're serving a person with dementia. We've done some work with medical offices. We did a moving company, I just recently worked with the Florida Bar to educate the people that work on their hotlines and in their offices. If you encounter someone who is displaying these behaviors, they may have dementia, and here's how you can respond to them and best meet their needs. So
Oh,
there's
that's good.
advocacy work that comes with DCCI, and then also increasing awareness. So I recently had a conversation with Commissioner Jack Porter about, getting a conversation started on what we can do to make Tallahassee a more friendly community to those living with dementia, making sure the infrastructure is there, making sure our transportation sector can meet their needs. We're also working with Safe Mobility for Life and Reach over at FSU College of Medicine, Department of Geriatrics, to work with Star Metro to make sure their drivers are educated on dementia and making sure that they provide a safe, enjoyable experience for all of their passengers, even if they do have a diagnosis of dementia.
That is really awesome. I wish I would have delved into that a little bit more, because I actually saw, and it bothered everything in me, but I actually saw this news, this video that it was circling around, I think about maybe 2 months ago, where this lady had gone into Walmart and she had dementia, and she took, I think it was a candy bar or something, and they called the police on her. She had exited the store and was actually walking down the street. Police officers came up and they literally manhandled this lady. I was so furious.
It's terrifying.
The way they talked to her, literally handcuffed her, slammed her to the ground. She ended up with broken ribs, bruises, and all because she had Alzheimer's, and the way they approached her, and she kept repeating herself. And so somebody should have, it should have clicked with somebody that something more was going on, but they literally abused her, not knowing. And so I think even with the police officers, I think that training, all of that is necessary. So it's very good to hear that this initiative is going on and that you all are working to educate those in the community. I think that is so very necessary.
Thank you. Yes, I actually just last month went to the Calhoun County Sheriff's Office and did a DCCI training with their deputies on, if you notice some of these things about a person, it may be an indication that they have dementia. If you get these kinds of calls, here's how you might approach it differently and avoid escalating that situation, avoid putting them in harm's way. And rather than making things worse, making sure that you can implement what needs to be done to even assist them in the future. Here's some tools and resources that you can give them or their families. So I'm hopeful I'll have that opportunity with some of the other law enforcement agencies in our service area. But the one with Gadsden, they were very receptive, asked some great questions, had some great scenarios that they brought.
It is absolutely necessary. Absolutely. So, if you're a business out there, you're listening, or you work somewhere where you think that this information as well is helpful, you here in the Leon County surrounding areas, please reach out. Take that opportunity to train your employees, because it's necessary. Everybody that is behaving a certain way doesn't mean that they're doing it out of being, whatever. Some of them, it's a medical condition. But if you don't know the signs or symptoms, what to expect, then, you can approach it a different way. You can take what they're saying a different way, because sometimes it is the aggressive behaviors that come along with this, but it's not always intentional. So reach out, get that information, get the training, so that you know what it is you're facing, you're dealing with, and it can be a great outcome for everybody. Sonnie, thank you so much for your time that you have offered me on today. Thank you for the wealth of information that you have provided. I know that this is going to be very helpful for those that are listening. And so hopefully you'll get some calls and we can get some people in that are actually going to take advantage of this opportunity. Thank you.
Yes, thank you. It's my pleasure. I appreciate you having me on.
Absolutely. Have a great day.
You too.
Bye-bye.
Bye-bye.
Thank you so much for listening to this episode of the My Favorite Girl Caregivers Corner podcast. Hey, do me a favor and follow on whichever platform you're listening from so that you can receive notifications when the next episode is out. And also share it with a friend. And remember, no matter what, keep going, keep pushing, keep loving, and keep caring.